I have some of my team members here to support me in the presentation to give you an overview of the clinical research record at UHN. First, I'd like to introduce Danielle Miller, who is our Compliance and Planning Associate. I would then like to introduce Shajareen Shahidullah, who is the coordinator mainly responsible for supporting clinical research record at my team. And also invited and joining us in a few moments will be Menaka Pulandaran, who is another coordinator on my team, but who works more with the Board of Record or Clinical Trials Ontario system. So I asked her to join us as well in case we have any questions relating to the use of external REBs or the Board of Record system. So today we're going to talk about the clinical research record and its implementation at Toronto Rehab. CRR was developed about 15 years ago at Princess Margaret, and it was mainly used for them as a study management tool. Later on, about just after 2010, clinical research record was implemented as a patient safety tool for all of UHN. And since then, we've been using it to protect research participants who are also patients at the institution. So today we're going to talk about what is CRR, give you an idea of how it does protect participation in research, how you would be able to obtain a CRR account, how studies are transferred from Capture to CRR, and how you would be able to request EPR access, and also how CRR links to the patient incident reporting system. So to start off with, CRR, as I mentioned, is a tool that allows a flag to be placed in a patient's electronic patient record when they're participating in research in a study at UHN. Now, as you can see, underlined is interventional because built into our Capture system is a way to determine whether studies are interventional studies, and I'll speak a little bit more about that. Essentially, the way CRR works is that research personnel will enroll patients into the CRR study record using EPR, and that will allow a flag to be shown whenever someone from any of the clinical teams look up that patient's record, or if the unit has a whiteboard, then it will also show as a code on the whiteboard. The code is CR for clinical research. So why is CRR important? Obviously, it's important as a patient safety tool because it allows the clinical staff to make sure that they are aware if one of their patients is also participating in research, and to be able to make sure that their treatment takes that into account, that there are no contraindications with whatever is happening in the research study. It facilitates communication between the research team and the clinical care team, because in case the clinical care team needs to contact the research team, there's an emergency contact number and top-level information about the study and the intervention that is being done in the study. So in emergency situations, for example, and this has actually happened, if a patient comes into the emergency room and happens to be a participant in a UHN research study, they would be able to see that and contact the PI if necessary to see how to best treat the patient in question. Finally, it also is linked to the incident reporting system and allows for incidents that involve patients to send a message to the PI for that research study to ensure that the incident was not research related. So how do you access CRR? I think most of you who are on campus at Toronto Rehab probably have a browser that opens up, and it usually opens up either to the corporate UHN research intranet, or if you're working from home, you probably also, when you open your browser, you will have the ability to connect remotely to the corporate UHN intranet. And when you connect to the corporate intranet using your credentials, you will see that in the top menu at the top of the screen, one of the options is research. And if you click on research, you will come to the research intranet, which is shown on this slide here at the top. And you'll notice that one of the tabs near the top of the screen on the research intranet is called Tools. And if you click on the Tools tab, you can then select clinical research record from the list, as you can see circled there. And then the CRR application will open as shown at the bottom of the screen. If you've never accessed CRR before, you will notice that there's a link at the bottom of the screen that says sign up here. And if you click on that sign up here button, that's how you will be able to register to obtain a CRR account. So here on this screen, you can see once you click on the sign up here link, a screen will open up as shown on the right-hand side of the screen, and some very top-level information will be requested for you to be able to set up an account. So just so that you know, CRR was developed, as I said, about 15 years ago. And so unfortunately, it does not use your T number or your RIS username as the basis for establishing accounts. It is based on an older system called CORE. And so you will have to get a separate credential for access to CRR using the CORE system. Once you register to get a CRR account, one of the requirements is that you do a CRR e-learning module. Now, most of you will have access to the Corporate Learning Management System, or LMS, called My Learning. And once you link into that system, you can look up the CRR e-learning module, and the course code is shown on the screen. I want you to make sure that you notice this point, that you use Internet Explorer to do this training if possible, or Microsoft Edge, because those will allow you to be able to access all the different parts of the training module. The module takes about a half an hour to do and is a requirement to get your CRR account. So how does an interventional study become transferred? So most of you will be familiar with the CAPTURE system, Coordinated Approval Process for Clinical Research, as this is the system to obtain all approvals at UHN to conduct research involving humans. The CAPTURE system at the end of the process will provide you with what's called institutional authorization. And once a study receives institutional authorization and is considered an interventional study, it will automatically be transferred to clinical research record system. So as you can see, following the dotted line here, once that happens, an email notification will be sent to the research team. And then the research team, once they get their CRR account, can start including basic information about the study. This is basically what we call study activation, because it allows the study to be created inside of clinical research record. And of course, during the life of the study, the research team should maintain that study up to date, because if you think about it, the flag that will be sent when a patient is enrolled to the electronic patient record is real time. And so once a patient is enrolled into a study, then that flag will be live at any time when the clinical team will look it up. So you have to make sure that if a patient is taken off of a study, that is updated inside of clinical research record. So once a study is activated, then the research team can request access to EPR and start enrolling patients into the system. And so this is why originally Princess Margaret used this system as a study management system. And this is how we're rolling it out now during this clinical research restart period. And so if you would like to add studies that were previously approved in CAPTURE, you can still do that at this point. We can add those studies manually to CRR, and then you can use CRR not only as a patient safety tool, but also as a study management tool to manage your enrollment of participants. So the definition for an interventional study in CAPTURE is based on the World Health Organization definition of a clinical trial. And you can see here that that includes any research study that prospectively assigns human participants or groups of humans to one or more health-related interventions to evaluate the effects on health outcomes. So you can see that it's a pretty broad definition, and studies that meet this definition, and this is basically by answering yes to one of the questions in CAPTURE that asks, is this study a clinical trial as per the World Health Organization definition, that will trigger the study to be automatically transferred to clinical research record once it receives institutional authorization to proceed. So at this point, I'm going to pass it on to Danielle Miller, my colleague, who will continue the presentation. And we're happy, obviously, to take questions right at the end and answer any questions you may have.
So one of the things that you will need, obviously, to use CRR is EPR access. For you to get EPR access, you'll have to complete the EPR request form, and you have to submit it to data security. Your supervisor or your manager will have to submit it. And I believe in the past, they have requested either the REB approval letter or the institutional authorization. So it has to be for a study that has already gone through the review process. The next thing that you will need is your EPR training, and this is offered through UHN Digital. If you go to their site, you will see they have an intro to EPR link, and they also have set up the EPR training as modules. So depending on the level of access that you need, there are different modules that you can do. And I think they also offer virtual classes that you can sign up for. I know they fill up quickly, so you should be able to check, and I'll send the link for the training and also for the virtual sign up. After this, I'll send it to Sophia, and maybe she can send it around to everyone. Next slide, Alex. Yeah. So once you have gotten your CRR account, you've logged in for the first time, and your study has been transferred into CRR, you need to update the study information. So there's study information, and adding your study team members is really important, because this is the information that once a patient or participant has been enrolled through EPR, this is what the clinicians will see when they go to look for those study details. You have to make sure also that you enter it in bullet form if possible, so that if they're in an emergency situation and they're looking at this information, they're able to pull up the pieces of information that they need quickly. The next thing that you have to do is update your basic information. So as Alex mentioned earlier, you have to update the study emergency contact information, because this is what clinicians will use to contact the study team. And the next thing that you have to do is make sure you change the study status from pending to open. When a study is automatically transferred to CRR, it is automatically given a study status of pending. So you have to go in and change that status to open. If you don't do that, you won't be able to enroll participants in your studies. Next slide. The other thing that you'll need to do is to ensure that you update your personal info, and you need to enter in your EPR ID. When you're signing up for the core account, that slide that Alex showed that had the sign up sheet where you had to put in your login information and your username, there's also a box for you to enter your EPR ID there. If you already know it, you can enter it there and it will be transferred here once you are able to log in. If you don't have it at the time, you have to make sure that you enter it before you'll be able to enroll participants. Next one. So how does a clinician know that a participant is on a research study? Once you've gone in through EPR and you've enrolled a patient or a participant on a study, there is a beaker icon that will show up on their record, and that is how they'll know. From there, the clinician can click the View Clinical Research Studies link, and that will open up to the information about the research study. So that is where they're getting those bullet points about what are the contraindications or any potential adverse events, and also information about the emergency contact and who is the PI. Next slide, thank you. So one of the other systems that CRR is linked to apart from Capture and EPR is the patient incident report. And this just ensures that it facilitates communication between the clinical team and the research team about any incidents or any adverse events or any unanticipated problems that the PI should know about. Next slide. So the way that this works is that once an incident is filed, it checks CRR. And if the patient is on a research study, it pulls the name of the PI and the study title, and it automatically sends a notification to the PI to let them know. And that way, if the PI needs to follow up with the clinical care team, they have the ability to do that. Next slide, Alex. So one of the responsibilities for the research personnel is to ensure that you're entering the information in CR accurately. And that's why it's important, especially when you log in for the first time and you're updating your study information, that you enter the emergency contact and you make sure that that information is kept up to date for the duration of the study. We also ask that when you are enrolling patients or participants on your research study, that you do it within 24 hours. So for example, you've gone through and you've consented a participant, we ask that you go in and you enter that person or enroll that person through EPR within 24 hours of doing that. And also to maintain the patient study status. So when you go in and you have entered or enrolled a person or a patient in a research study, you have the ability to say whether they're on active treatment, whether they're screening, whether they're in follow-up. Go back, Alex. And again. So for the clinical care team, obviously their responsibility lies in checking EPR, looking out for that beaker book icon, and ensuring that they contact the study team if they have any questions. Also, notifying the study team about any incidents, and this is facilitated through the incident reporting system. Next slide. A few important things is we do have a CRR policy, and I'll send a link for that along with the rest of information I'll be sending to you, Sophia. Also that you need to update and maintain your information within CRR and try to enter your patients as they're being enrolled as soon as possible within that 24-hour period. Also to remember that when you do sign up for that CRR account, you have to make sure that you email CRR@UHN Research. This is where they're going to check to make sure that you've done your training, and then they can go ahead and activate your CRR account. Also, if you have any questions, please feel free to send an email to crr@uhnresearch.ca. And we do have a CRR intranet page that also includes more information. So we'll be taking any questions now. I think I see a number of questions here in the group chat already. I think the first one says, if a study is not interventional, for example, surveys or observational, then do we need to use CRR? So right now, CRR is mostly for interventional studies, and that is automatically transferred, but you do have the option, if you would like, to use CRR as a study management tool that we can manually add your study. The next question I see, is CRR part of Capture and will be generated directly when the application is submitted to Capture? So CRR is not part of Capture, it's just linked to the Capture system. And Capture transfers the study information to CRR after it has received institutional authorization. So it's not at the time that the application is submitted, but rather once the review process has ended and the study has been authorized, it transfers it overnight. So for example, if you have received institutional authorization today, then the information for your study won't be transferred to CRR until the next morning. The third question here I'm seeing, okay, I think Shajareen answered that question. There are 3 more messages here.
Maybe just read it out, Danielle, that way everyone can benefit if you don't mind.
No, it was Shajareen's message. It just says, hi, Louise, general CRR is a clinical trial interventional studies. I answered the question already, that's why. Here somebody said, so only existing studies need to be manually added to CRR? Yes. So if there are existing studies that have never gone through that transfer process, or studies that you feel should be in CRR, those are the ones that would have to be manually transferred. And you can send an email to crr@uhnresearch.ca, and the CRR admin will help you to manually add those studies. The next question I see here is, if a study participant is recruited from outside of UHN, so non-UHN patients, would they be added to CRR? So we've spoken with Digital about the potential of adding healthy participants, and they said there is a way to do that. You would have to create a research visit within EPR. So I think once you've gone through the EPR training, it would be best to touch base with Digital about how exactly to do that in EPR. Those are all the questions that I've seen so far. Are there any other questions?
Danielle?
Yes.
Hey, so I believe what Evan was asking is, what will we do with a non-UHN patient?
Yep. So like a patient from outside, or is it a healthy participant?
I think outside of UHN, if I'm not
So
mistaken.
either way, I think they would, if you want to still enroll them, what Digital told us was that they would need to create an MRN for this person. Everybody in EPR has an MRN, and then they would have to be, I guess, booked through a research visit, because they have clinical visits and research visits in EPR, and that's what you use to enroll a participant on a research study. So they would have to create a research visit. I don't know the details of creating a research visit, so I think it would be best to contact Digital. They do have lots of resources, and I know I've sent some of those resources before to some of the research teams that were piloting CRR for KITE, but they do have some resources with instructions and pictures on how to create different types of visits in EPR. So it says, so is it required for every study patient to be entered into EPR, or is it the discretion of each study? So if your study is in CRR, so let's say it's been automatically transferred over, it's an interventional study, then every patient that you're going to be recruiting as part of that study should be entered in EPR, or should be enrolled through EPR into CRR. The next question says, would researchers be sent a CRR link automatically after IA is granted? So maybe I'll let Shajareen take this, because I know there's an email that's sent to the study team. Shajareen, what are the details in the email that's sent?
Yes, so exactly what Bing says. The moment the study moves over and I've basically added on the study team to the study, an email gets sent out to you, and you get that link, and it tells you what you're required to do. It gives you instructions on basically which study patients, how to go ahead and add the patients onto CRR, as well as how often you need to be updating that. So to directly answer what you asked, a link will be sent to you once the successful transfer of the study has happened into CRR.
Sophia, I think that some of the coordinators at KITE have the knowledge on how to assign an MRN to a healthy participant, or to a person who would be a non-UHN patient. So I think that knowledge is there at KITE. We don't specifically use EPR, of course, so we're not the experts in that. But maybe, Danielle, do you remember which teams have been doing that? Is it Louise's team or another team?
I'm not sure. I know that some teams already have access to CRR, and that they did do a piloting for testing how to enroll a participant so they're familiar with it. But I don't believe, Louise is saying, no, we don't assign non-patients in EPR.
Okay. I know that it's one of the other teams at TRI. So maybe we can look that up and send that to you, Sophia.
Yeah, that will be great. Thank you.
So I think someone has a question here. It says, are existing studies required to be manually added to CRR, or is it up to the discretion of the team? So I believe, I don't think TRI has as many interventional studies that would have been automatically transferred from Capture. So generally for those ones, we think it would be best to manually add those. But if your study is not an interventional study, I think that is up to your discretion if you would like to use CRR as a study management tool.
I will just add that I think during this clinical research restart period, the CRDL or the person approving the study for KITE, for TRI, those studies, they're asking that they be entered if you're restarting a study that was suspended. But perhaps Sophia can tell us a little bit more about that.
Yeah, so as the UHN Clinical Research Restart Committee, when we are looking at the restart activity, I think we all agree that we should encourage all the study to enter the CRR for tracking, for monitoring. So I think if there are existing study at KITE, currently not using the CRR, we will encourage people to look into how to add your study into the CRR. And of course, as Danielle said, probably needed to work with UHN Digital to figure out how we added the healthy participant or non-UHN patient into the system. Because I think a lot of KITE studies indeed using the healthy participants.
Yes.
And Sophia, I just wanted to add, I know that Digital mentioned if you need it, they're able to set up a virtual training session specifically for KITE if you have enough people. So I probably will send you the contact for Digital that we have been speaking with, and maybe you can look into whether that would be possible, because I know they already have the virtual classes, but they fill up pretty quickly. So if you want something specifically for KITE, it probably is best to arrange something with Digital.
Yeah, thanks. When I get the contact information, I will check what is the requirement, how big the group is. Then we can collect information from KITE to see if we can organize a session for KITE.
Okay, so the next question here is CRR like a participant's master ID list to record participants' information? I wouldn't exactly say it's like a participant's master ID list. It's more of a communication tool so that clinicians know that a study participant is on a research study. I think it would be best to probably keep your master ID list separate, because if you want to de-identify or do any of that information, you will have more freedom to do that than using CRR and EPR to do it.
But Danielle, there are a few reports that are available in CRR that study teams may want to take advantage of. I wonder if you could just maybe explain some of those to the group.
So some of them that are available, I don't think there is one with the patients, like a patient list information. There is an audit history tab that you can see when there are changes made to a patient that has been enrolled in the study. So for example, if there have been updates to the patient study status or even to the study status itself, you're able to pull that information. But that is just through an audit history. It's not really a report per se. So I would still say to keep your own master list separate. I think you have more flexibility with the information that you want to include on the master ID list.
Shajareen, I was just going to check with you. Is there an easy report to get a list of all the patients enrolled in a study?
I'll have to double check on that, but I believe there is.
Yeah, I think the reporting function of the CRR is also another reason why the UHN Clinical Restart Committee would encourage everyone to use it, is because we'll be able to monitor how many participants enrolled and what testing being done. I assume that can all be exported in the report, Danielle?
Yeah, there are different reports that can be exported. Our view is a little bit different in terms of the reports that we have access to, and we just get everything, so it's hard to pull out for a specific study. I really am not sure if you do have access to a list of patient information, but we will double check that and get back to you.
Okay, thanks.
But there is definitely a section where it says patients enrolled. So when you go into that section, you actually can see the list of everyone. So you see all their names, their MRNs, and you can see their study status. So whether they're enrolled, whether they've consented, whether they've completed the study. So that's a very handy list. So you can definitely see that per study in the patients enrolled section.
Great, thanks.
Okay, I don't see any other questions coming up. Okay, perfect. It says, will you be able to share these slides after the presentation today? For sure, we will send them out to you, along with the information that I'll also send to Sophia.
Yeah,
and that will include all the links.
For everyone, we are indeed recording this session, so we will make the recording, the video available after the meeting, and I will send everyone the link to the video along with the slides as well as the information that's relevant to this meeting.
Okay. Any other questions? The CRR training or the e-learning goes into a lot more detail, and it actually clicks through all the steps that you'll need to do, and it's pretty short and very concise. So I think for sure take a look once you've signed up for your core account and go through the process. Pretty straightforward. And in terms of for EPR, I'm not exactly sure. I've never gone through the EPR training myself, but as I mentioned before, I think there is an intro to EPR, which says chart review, which is just the basic overview for EPR that you would need to get started. And then again, depending on your access, you may have to register for those virtual classes.
And if you, oh, I see another question.
It says, will you be able to share these? Oh, sorry. It says, how do we set up a core account? I apologize if you answered this question. Okay, so to sign up for the core account, when you go to the CRR login page, there is a link that says don't have an account, sign up here. And when you click sign up, it will open another window, and there you'll have to create a username. You'll enter the password that you would like to use. So you have to create a password for it. You will enter the site that you're at. So for you, it would be TRI. And then the version of CRR, which is Toronto Western, Toronto General, and TRI. And if you already have your EPR ID, enter it there. Also, once you've done that, you will need to do the CRR e-learning. And then once that is finished, you will email CRR, the CRR coordinator, so CRR@UHNresearch.ca, and they will activate your account for you and let you know once it's activated.
So one thing I may want to suggest to everybody, everyone who's interested in using CRR, you may want as a first step to try and establish your CRR account and access. And Shajareen on my team, who is the main person to answer the CRR@UHNresearch.ca email, will help you to get set up. If we do that as the first step, then you will be able to get started. And if you want to add any older or existing studies that were not currently in CRR into the system, we can work with you to add them manually, as Sophia mentioned. Shajareen has just sent you the link to request a CRR account in the chat, so that you can have a look at that. We're always happy to answer any questions, so feel free to reach out to Shajareen, Danielle, or myself. For those of you who don't know us, Danielle and myself used to work at TRI 10 years ago prior to the merger with UHN. So we do know a lot of you. We were then switched over to RSS during the merger, but we're happy to work and support TRI in this implementation. We're happy to work with you to get your account set up and to help you with any study management options that you want for these studies.
Alex and Danielle, I think there is a question sent to me saying, do we need the REB approval to have the CRR set up?
You don't need it to have CRR set up, so you can sign up for a core account and do the training ahead of time, but there won't be a study for you to update until the study has received institutional authorization. So once the study,
Yeah,
go ahead, sorry.
Go ahead.
Once the study has received IA, if it is an interventional study, it will be automatically transferred. If it hasn't been automatically transferred, but you still feel that you want to use it as, you still want it to be entered in CRR, then contact us and we can manually enter the study for you. Once the study is in CRR, that is when you can go in and you can update the emergency contact or the contraindications or any of the study information.
Thank you. So I think that's all the questions we have. And as Danielle said, always feel free to send the email to the crr@uhnresearch.ca. And we're going to share the information on the session as well. So if we don't see any more questions, thank Alex, Danielle, and your team for taking your time to share the information on the CRR and answer the questions. So I guess we will wrap up today's session, and everyone has a great day and also enjoying the long weekend.
Thank you very much.
Thank you so much.
Thank you.
Have a great day.
Bye.
Goodbye.